doctors always ask, what are you looking for? So I'm going to share with you what we look for. So probably the most important thing that we look at first is polyps like these. Now these are we call precancerous polyps. They're not cancer, these small ones. These are the ones we want to find. We want to remove them. And when we remove them, we've eliminated the risk of cancer. So, we always say that colon cancer is one of the most preventable cancers, because if you get a screening colonoscopy, you can remove the polyps that cause cancer. And if it's too advanced, for example, a big polyp like this, we get it early, right? Even though we may not be able to remove it through our scope and our instruments, we can identify it. And if it's large enough that we can't take it out, then we will do surgery and take it out. So this is a typical colon cancer that's invading a part of the colon. We don't want to get to this point, so it's important to take these polyps out early so you don't have something like this. But sometimes it happens. If you don't get a screening colonoscopy and it's your first time, sometimes we find this, and we move very quickly to get treatment that you need. It may require surgery, it may require other treatments, it may require chemotherapy or radiation treatment, but whatever it requires, you get it done early so that you have a good prognosis. Now, sometimes we find advanced polyps, and when we find advanced polyps like this, sometimes we're able to remove these through our instrument. We have different techniques, such as endoscopic mucosal resection or endoscopic submucosal resection, which is called ESD. So we have EMR and ESD, fancy words, but what it means is that we can remove the polyp safely with devices that we have. We can also do full thickness polypectomies, which are techniques where we can remove the entire polyp using a special device. A few years ago, we didn't have these techniques, so if we found a polyp of this size, you would have to have a local resection of some kind with surgery. So the advances in technology have been tremendous in the last decade or two. So it's important, again, to get screened, get a colonoscopy, and find out, what you have. If you don't have anything, which is what we shoot for, and honestly, the majority of people don't have anything. They have a normal colon. That's good news for you. It's peace of mind, and also you don't have to have another procedure for 10 years. So that's the upside of this whole process. So if you go in a little further, you can see here different types of polyps. Not all polyps are pre-malignant, which means that some of them are completely benign. So if you have a completely benign polyp, again, you don't need to have, a procedure for a number of years. So again, another advantage of finding out what kind of polyps you have. And lastly, I always stress this. We have a picture here of inflammation in the colon. Inflammation in the colon can be from a lot of different things. It can be from infection. It can be where there's inflammation of the lining of the digestive tract. It also could be a different type of process or disease. It could be Crohn's disease, for example, or inflammatory bowel disease. That comes with a little bit of risk for colon cancer, and that presents in a different way. So if you have inflammatory bowel disease, such as Crohn's disease or ulcerative colitis, you are at a slightly increased risk of developing colon cancer the longer you have this inflammatory bowel disease. So it's important to get screened regularly. See your physician, your gastroenterologist, your colorectal surgeon, whoever's caring for you for the inflammatory bowel disease, and make sure that you get the colonoscopy screening, because that's the best test really for you, given the fact that you're at slightly higher risk. And also, lastly, not everything is bad in the colon, right? So we have normal tissue, and that's what we look for. So if you get a colonoscopy and you have a normal colon, as I mentioned earlier, you don't need to come back for a number of years, and you have that peace of mind that you have a good, healthy colon, and that's the most important thing. So screening should be really should be done without any symptoms. You shouldn't have any symptoms. You should just be of the age, we recommend, currently the guidelines are age 45 or 10 years younger than a family member who had a colon cancer or a colon polyp. For example, if that person was 40 when they had colon polyps, then you get your colonoscopy at 30. So it's important to know those things. And it's also important to know what we call the alarm signs, right? The alarm signs are rectal bleeding, weight loss, abdominal pain. Those are the main ones. Some people also have, change in bowel habits that are inconsistent to what they normally are. I have patients come in sometimes say, I had normal bowel movements and now I don't. So what happened? I'm worried. I noticed some rectal bleeding. You don't want to get to that point because when you get to that point, it means that maybe something's going on, and it really means you need to get a colonoscopy right away. So we want you to start doing it at the appropriate age when you're ready to do it, and don't put it off. Because if you have symptoms, go and get it done right away. But if you don't put it off. Come and get your colonoscopy. It's not a big ordeal. It takes, in most expert hands, 20, 30 minutes to do. The preps are a lot better these days. And I think the majority of patients that have this will tell you that it's a good experience.